Cordial greetings. The following are the accreditation and habilitation standards of San Ignacio University Hospital. The hospital vision broken down into 7 milestones that have evolved as follows. 1. To lead an integrated health service network. 2. Achieving recognition as an international academic medical center. 3. New building. 4. Maintain accreditation as a university hospital maintained. 5. Increasing intellectual production. 6. Surplus in accordance with the financial plan. 7. Expand medical outreach and extension programs. On 7 April 2016, the Ministry of Health and Social Protection and Colombian Institute of Technical Standards and Certification awarded it the certificate as an accredited institute after a process of more than 6 years, in which its Human Talent Committee to continuous improvement managed to consolidate process and indicators to be recognized as one of institutions providing health service with the highest standards of quality at national level. This process, which involved 6 self-evaluations resulting in various adjustments and administrative care and infrastructure adjustment, has enabled it to meet the goal of achieving high quality standards.
In the elements of the mandatory system of quality assurance inherent in the San Ignacio University Hospital, first, patient safe program, increasing the number of instructional packages implemented from 47 to 52 with an average completion of 69%. Second, in the clinical management, documentation and implementation of the areas corresponding to health promotion and maintenance, early childhood, adolescence, and old age, management of clinical practice, guidelines, review and update, development of 7 interactive flow charts and 3 clinical pathways, adoption of 5 patient days. Additionally, there is the unique qualification system, qualification audit with completion of 93% and development of 100% of the student. The unique accreditation system, monitoring on institutional improvement teams, accreditation access, primary improvement teams, and self-evaluation teams with global complete of 92%. Self-evaluation of accreditation standards with an overall rating of 4.1. The evaluation of the improvement plans went from 66% to 88% of progress, implementation of the indicate analysis methodology in 12 additional primary improvement teams for a total of 33 corresponding at 97%.
Audit program for quality improvement. The quality evaluation of the medical history record presented a score of 89%, continuing with the peer audit methodology in each service. Audit of the transplant program with a 93% competence. About the infrastructure and technological renovation, given the increase in the demand for PCR tests for the detection of SARS-CoV-2 virus. A specialized area of molecular biology was implemented within the laboratory to process this type of test. This happened going from processing 291 tests in April. And about the human talent loyalty, the execution of 100% of the activities planned to strengthen humanization within the framework of the performance management as a leadership tool program. 370 supports were received for carrying out the feedback exercise focused on the manifestation of organizational competence.
Investigation. Alliance with the Pontificia Universidad Javeriana in national and international calls with 20 projects. In total, 237 scientific articles were published with the affiliation Hospital Universitario San Ignacio. The hospital continues to consolidate cooperation activities in research and innovation with the clinics and hospital of the Bogotá. Social service with the Fund for Poor Parents supported by Mr. Arturo Calle. 64 parents were treated with the support of service not covered by their insurance. A Donate a Food from the Here campaign was carried out in which HUSI employees donate food or money for the necessary people who work in the hospital. For example, cleaning staff, security, laundry, contact center, and food services.
The Hospital Universitario San Ignacio has a quality assurance use card program that includes a patent safety program and implementation of bioassurability. It also has a strengthening of clinical safety in healthcare service and self-management. It has a coverage of outpatient units and hospital service 100% compliant with the schedule. Inclusion of clinical care rates. Fusion of work in self-management of accreditation standard with an overall score of 4, development of quality leaders training course and the risk management model with 100% coverage health, clinic and laundry audit accreditation in hospital bed. In terms of patient safety identification and management of individual clinical risk in handled, increased in clinical and patient safety care service, implementation of the patient safety module and training.